For all you parents and grandparents out there getting your kids ready for back to school, probably getting a physical has been part of the routine along with getting your back to school supplies. But when is the last time that you had a physical? That's our conversation this morning. Lynn Grotefendt is a nurse practitioner at CHI Memorial Family Practice Associates Northgate. Good to see you.
Welcome.
And I told you that you'll be talking to me directly because true story, in my kitchen yesterday, my husband was saying, Julie, please just take a day off from work and go see every doctor that you need to see. I stink at it.
You and everyone else. So everybody's scared to get physicals, but there's nothing to it. We usually do just basic blood work, but a full physical exam, but we discuss even personal issues such as alcohol. We discuss smoking, we discuss your job, stressors, we discuss your diet, exercise, and amount of sleep. All this is very, very important when you go in for a physical now.
Okay, so I would think, I'll put me on the exam table.
Okay.
You would ask me a number of questions and I would answer you truthfully.
Right.
But I might hold some things back.
Well,
is that a problem?
Yes, it is. When we get behind that door, everybody needs to realize that once that door is closed, that is our private time to talk. But in order for us to take care of the patient, we need to know everything. And I'm really big about letting them know what's said behind this door stays behind the door. But I have to have everything out there. I'm a big believer of trust and honesty, and I let patients know we don't judge them. We're here to take care of them. But I have to know everything.
Okay, so I said your annual physical. I won't tell you how long it's been for me, but there are a lot of people who don't go every year. And since you said trust is a big part of it,
Very much.
repetition builds that trust.
Exactly, and getting to know your provider is so important. You know, having that rapport, letting the provider get to know you, your family history, letting your provider get to know your regular exam of what your normal and abnormal is. That's how we pick things up. That's the beauty of primary care. We get to know our patients, not only just physically, socially. We look at their family history, look at their amount of stressors in their daily life. All of this comes into play for their care in the long run.
So how frequent is it for you that someone comes in, maybe they have come every year, maybe they haven't, but through conversation with you, they leave going, I hadn't thought about that before.
Right, right. Very often, very often. We assess patients for alcohol use quite frequently now because it is very, very large issue. A lot more people drink alcohol than they let on, but we have to know what is the normal amount and, you know, what are your risk factors associated with it?
So, okay, let's expand on that a minute.
Okay.
Are you asking those questions about alcohol out of concern of alcoholism or out of concern that even if you're not an alcoholic, if you're drinking too much, it can affect other parts of your body?
Exactly. It's not always alcoholism, but a woman, most women should only consume 4 ounces of alcohol in a 24-hour period. Men can get away with 8 ounces. But sometimes that 4 ounces leads to 8 ounces, you know, and further along.
Right.
So that can progress to alcoholism. But we're looking at it through their overall health, weight gain, blood pressure, diabetes, cardiac health. All that plays into it.
Okay, let's talk about the weight issue that continues to be, you know, frontline in this country. The Today Show earlier this week did a whole thing on teenagers and
obesity. It is huge. We have more of a sedentary lifestyle. We're consuming more processed food. One of the big things that I see is something called non-alcoholic steatoretic hepatitis. I'm seeing elevated liver functions all the time from our diet, not always alcohol.
Really?
That's very, very scary for the future. So we need to address even these teenagers now about processed food, fast food, sedentary lifestyle, because this is going to affect their liver health down the road.
And the Today Show's focus, as I caught a glimpse of it, was on the fact that they're so obsessed with the number on that scale, that then you're seeing eating disorders surge because of it.
Yes, yes, and too many women and some men are not being screened heavily enough for that. So I really look at their weight every year or every time I see them. I look at their body mass index, which takes into account height, weight, and central obesity. if I'm seeing that start to drop, and I look at some of their lab work, if their protein levels, their albumin levels start to change, sometimes I'll see it on their electrolytes, but I really start to look at the big picture and go, what else is going on? Why are they losing weight? So that's big.
Okay, what about making the visit the best it can be? You were saying that this is a great time actually to get one.
Oh, in the summertime we have less cold, less flu, less illnesses, so that's the time to get your physical. Absolutely the best time. We're not near as busy during this time, and we have time to spend with our patients and answer the questions they need.
Okay, but even still, that time can go more quickly than the patient might realize. So is it a good idea to come in with kind of your own bullet point list of things you want to address?
Everything. And I need medications, I need herbal supplements, I need, if you've got notes from any other physician that you've seen, if you've gone to the emergency room, I need all that to look at everything. But I want people to come in with that list of questions and ask. This is their time to ask me anything.
At the office, then, you can self-refer? If you don't have a doctor that you've seen before, you can just call and make an appointment? No need to have a referral?
It depends on the specialist.
Okay.
Now, for specialists, they require referrals from a primary care provider.
But in your office?
My office, no. They just call the office and make an appointment, come in to be seen. Much of the time, I do the first visit as a physical because that's when I really get to know the patient. I like them fasting when they come in, so I can check a lipid panel, and I screen heavily for diabetes now because that is a very big deal
And
now.
how long does it take to get that blood work back typically?
Usually about 72 hours,
Okay.
depending on what I've ordered. But we, in our office, we call the patient back. But many memorial offices have a patient portal. They can go online and see those labs. But I love for patients to have copies of their labs too when they leave. I like to sit down and write on that lab and say, this is your cholesterol, this is what it should be. This is your sugar, this is what it should be. All of this is very, very important for them to visually see to make changes in their life.
You're a teacher as much as you are a healer.
Very much. And that's the beauty of being a nurse practitioner. We're nurses to begin with, and we educate a lot.
Here's how you can find her. Again, her name is Lynn Grotefendt. She is at the Memorial Family Practice Associates, Northgate. Their phone number there, 870-1999. Don't have to have a referral, just simply call and make an appointment. Thank you so much.
Thank you.